Hello, I'm Dr. Hanume Gowda. Knee joint injuries are very common. Whenever we talk of knee joint injuries, we are not talking about the bones but the joint itself. In the bones, there can be fractures, but they are very visible and we know there is a fracture. Patient has got severe pain, swelling, bleeding. So treatment, by and large, patient in themselves come for treatment. Then there are ligament injuries which are not visible. It can't be seen on X-rays. You need special tests like MRI scans to diagnose them. The commonest injury is a ACL ligament injury, that is the anterior cruciate ligament, also called the key ligament of the knee joint. It gives a stability where when you walk up and down the stairs or when you run or when you suddenly take off from a standing position, they give stability to the joint that you don't fall. So whenever that anterior cruciate ligament injury has happened, when it's completely ruptured, your balance of the knee joint will come down. When you suddenly try to turn to a side or suddenly try to take off from a standing position, you tend to fall or you feel like you are about to fall. There is a feeling of fall. Whenever you have an anterior cruciate ligament injury, you tend to have this apprehension that you will fall. So you always try to take care. So whenever such a situation is there, you will have to get operated and get the ligament reconstructed. There are tissues in your body itself around the knee joint which can be harvested from there and used as a ligament into the joint. We do it with minimally invasive surgery, also called arthroscopic surgery. Recovery is very fast and almost always guaranteed. We have got almost around 30 to 40 years of experience from older this one to now newer implants and newer ways of doing it. So the recovery is always almost guaranteed. You don't have to really get worried about getting a ACL reconstruction done. Do all people need ACL reconstruction? No, there are about 20 to 30% of the knee joints which are ACL independent. When we say ACL independent is the stability of the joint does not get affected even with a complete ACL rupture. So we'll have to clinically assess you and after that probably if required get a MRI scan done to find out how much of injury is there and accordingly we treat the patient. So most of the patients, like 70 to 80% of the ACL injury patients will need a surgery in terms of reconstruction. If you come early in the day 1 or day 2, sometimes the same ligament that you have can be sutured back also, which is not done very frequently, but because patients don't turn up as early as for now 2 days, if they turn up early, probably we can suture it back as well. A pretty common problem that we see these days is fever associated with joint pains. It's become very common. People call it chikungunya fever, people call it dengue fever. Any fever that affects your body can lead to a joint pain, which will be a temporary situation or a short-term situation. During the fever, you do tend to get a lot of joint pains and body pains. That's because of fatigue. Fatigue is weakness. Sometimes this joint pain can get prolonged. This happens with infections like chikungunya. Definitely, yes, chikungunya can lead to such a pain. But there are other fevers similar to chikungunya. When you do a blood test, the chikungunya fever is negative. There are no other indicators that can be definitely taken as a reason for this pain. Even typhoid at times can lead to a long-term joint pains. So why does this happen? The joint pains in or after a fever is because of a reaction within your body that happens between the immunoglobulins. Whenever there is an infection, there is an immunoglobulin produced in the body to fight that infection. When there is a second infection, there is a new immunoglobulin that comes in. Sometimes these two can have a reaction within your body and that can lead to joint pains. There are multiple other things that can happen, but we are talking only in terms of joint pains. It can happen in other systems also, other situations. It can affect the kidney, it can affect the lungs, it can affect the liver, it can affect most of your body parts. But we are talking only about the joint pain that happens because of this immune reactions. These come under a condition called autoimmune reactions. So whenever you get this, the reaction can go on for sometimes about 3 months, sometimes up to 3 years, sometimes longer. So according to your symptoms or according to your timeline, we put you on treatment. Usually they're all controllable, treatable, and sometimes, by and large, it is self-limiting. By end of 3 to 9 months, complete recovery from these fever-related joint pains is always a mandatory thing. Very rarely it can go on to become a long-term thing. Then we'll have to check for things like rheumatoid arthritis or seronegative arthropathy. They're all larger topics. So these are something like rheumatology issues. If at all the pain and your symptoms don't come down by around 9 months, then you'll have to get higher investigations done and take medicines accordingly.